The main contributing factor to blood vessel disease relates to fats and oils, free fats and oils, whether it's the heart, the legs, the feet, the kidneys, the eyes. One of the main killers is the heart, and there's stroke. Blood vessel disease is the biggest killer out there. People feel safe, suddenly they hit a point and they're in a different situation altogether, looking at the end of life or a situation where they'll have to have high care for the rest of their life. We need to look at this problem as a system. We have nutrition, avoid injurious foods, exercise, water, rest, including the pancreas and stomach. That's often forgotten about. Oxygen, sunshine, mental health. Any one of these is a foundation for improving health, or if we're not abiding by those natural laws, that will go against us and cause the blood vessel problem. The endothelium is your lifeguard. That's the lining, a single layer of lining that's on the blood vessels and on the lymphatic vessels. The endothelial cells, they require nitric oxide, so that's what makes things dilate and be flexible. That's what we look at in a Doppler test. One of the things we'd look at, if a artery does not cut off under pressure, well, there's a problem with the flexibility. But there's other things also we look at, of course. This is compromised, that is the dilation and flexibility of the endothelial cells in one free fat meal, such as McDonald's, or it could be just in the kitchen. The body recovers after hours, but then it happens over and over again until we're in chronic problem. So they find, when they did autopsies on people at high school age, they already had the beginnings of blood vessel disease. So it's happening over a long period of time. What helps to rebuild the arterial system is our green leafy vegetables, but it'll have no effect if the combination is wrong, if our eating habits, our lifestyle is wrong. It will just do absolutely nothing. America's most widely consumed oil causes genetic changes in the brain. So that's what the headline said. So we wouldn't get a cholesterol reading on this, but it's causing major damage when they look into it. So that was a headline just recently. And there's been other such warnings that have been given over the decades. The free fats in our foods allow things to stick together, such as red blood cells, as seen in a live blood analysis. So you'll see the fatty particles in the live blood analysis, and you'll see the red blood cells sticking together and their shape has changed. So this is going to have an effect on oxygen and absorption. As LDL becomes oxidized, and as they pass into the epithelial sublayers, macrophages come along to clean up these oxidized particles until they're overwhelmed. So looking at this, the macrophages engulf the oxidized low-density lipoproteins by endocytosis, so it wraps around this particle, takes it into itself via scavenger receptors, which are distinct from the LDL receptors. The oxidized LDL accumulates in the macrophages, which then become known as foam cells. So it's the same cell, but it changes state. It's become full of these particles of oxidized LDL. Macrophage foam cells play a critical role in the occurrence and development of atherosclerosis. When the inflow of the cholesterol increases, its outflow decreases. The macrophages are ultimately transformed into lipid-laden foam cells, the typical cells in atherosclerotic plaque. The chemical interplay with the cell wall, because this has become the barrier, weakens the structure, and allows it to rupture. People with kidney failure have accelerated blood vessel disease as they can't get rid of enough of their ADMA, a product of protein metabolism in the system, so it mucks up their metabolism of nitric oxide. What would lead to this point? Obesity, hypertension, high cholesterol, insulin resistance, diabetes, smoking, high homocysteine, high triglycerides. So what they found is that individuals with high HDL-C levels are not protected from cardiovascular disease. They thought that this was protective. Furthermore, clinical studies aimed at raising the HDL-C levels through niacin and CETP inhibitors have failed to reduce the risk of cardiovascular events and have stopped prematurely due to lack of efficacy or increased number of events. More people were dying. So this happened as they're looking at drug trials in which they would increase the HDL and decrease the LDL. A molecule within the HDL, ApoA1, under oxidization has a reverse effect of turning from anti-inflammatory to pro-inflammatory under the effect of oxidization. So it changes its status. Thus we get a glimpse here of how genetics work. In a plant-based diet, the total cholesterol and the LDL and the HDL actually go down and is protective. Now, medications can also affect what's happening, such as the beta blockers, the anabolic steroids, progestogens. All these medications can depress the HDL. Let's go back to think of nutrition, plant-based thinking system. This is the way we reverse the blood vessel problem.